If you're a transgendered person looking to transition and want to preserve your fertility, there are gender-affirming options for you. And today on Lunchtime Live at the Center, Dr. Priya Phulwani is here to talk about the gender program at Connecticut Children's Medical Center and how they work with CARS for fertility preservation. Dr. Phulwani is both an adult endocrinologist at Hartford Healthcare, as well as a pediatric endocrinologist at CCMC, where she is the medical director of the gender program. Dr. Phulwani, welcome.
Thank you for having me.
Yes, tell us about the gender program at Connecticut Children's.
So, the Gender Program Clinic at Connecticut Children's is housed under the Pediatric Endocrinology Department. So, that is where referring providers would send in their referrals. Our goal at this clinic is to provide gender respectful care to both transgender but also gender diverse youth that are specifically interested in medical management, so in hormone options.
Okay. Have you been there for a while? How long has it been there?
Oh,
Clinic.
goodness. As an official program, I would say since about 2011, maybe.
Okay.
So we've been there for a while. We've seen patients prior to being a formal program as well, but I would say around then is when we more formalized our program.
Got it. So what should patients and families be aware of before their first visit there?
I think a great source that I want to make sure people have if they are young and they're looking for gender transition options is the Connecticut Children's website. So it's www.connecticutchildrens, all one word with an S, .org/gender. And this website has resources, not just on how to refer for providers who are referring, certainly that's useful, but also support groups, how to navigate through school transition, legal transition, multiple resources. And it does describe what patients can expect at their first visit. What I'd like to emphasize in there is I'm very happy to see families just for information, but if they are looking to proceed with actual prescriptions, I do need the mental health support clinician's letter. So for adolescents, the guidelines do recommend that they have support. This is a big step in their lives with a mental support clinician prior to starting hormone therapy, but also through that transition. So they have that support as they're navigating school and adjustments and family disclosures. Life is hard enough as a teenager, and then you have this added transition that you're going through. So I do like them to have that support. And so I'll see the family for information. And then once we have that letter, they've had a chance to absorb the information that I discuss, they have the support of their therapist and their legal guardians, we can actually proceed with next steps. And if they're wondering, the family's wondering, where can I find a therapist? How do I know if my therapist is qualified? All of that information is very nicely listed on the website as well.
Oh, that's great. I was going to ask that question, if the therapist has to be within your facility, or can that person be outside of the facility? And
They can
that's answered.
absolutely be outside. Yes, they can be outside. They need not even be one of the providers on the list, which is a statewide list. They can be a provider that I don't have listed there, as long as they would then send me an appropriate letter and what's called a WPATH qualification checklist. There's a link on the website. It basically says, have you had experience working with teenagers? Are you comfortable making the diagnosis of gender dysphoria? Are you aware of guidelines such as that put forward by the WPATH, which is the World Professional Association of Transgender Health? And so it's just confirming that this is the therapist who really understands what they're doing. And if they send that checklist to me along with their letter, we're fine. So it need not be someone who's necessarily on that list even.
Okay. So what are some hormonal options or hormone options? What hormone options are provided at the clinic, and for what ages are they?
Yeah, that's a great question. I get asked that a lot because the guidelines have changed over time. So let me first start with the options. So if the interest is in an early puberty child and they are deciding that they want to proceed with some sort of option to just pause their current puberty, then we have medications that are called GnRH agonists.
Okay.
So this is considered a reversible option. So in other words, if you were to stop this medicine, it's pausing your current puberty. If you were to stop it, you resume puberty right where you left off.
Okay.
Okay, so that would be somebody who is, maybe they're older and they want more time. Maybe they're younger and they just started puberty. So for either of these categories, it's a good option. I will say that if you're not even in puberty, there really aren't any medical options. I tell these families, just love and support your
Mhm.
child, see which way they're headed. Just love and support them, let them express themselves. And if after the start of puberty, they persist in wanting to transition to a gender other than that which they were born with, then we can talk about medical options. Also important to keep in mind, some of these teens, some of these post-puberty kids may decide that they want to socially transition and not want medical options. So give your young kids some time and see what happens at puberty. And then if they persist, we can talk about the reversible options that I just mentioned, the GnRH agonist. And then for the older teen, we can talk about more irreversible, I should say, options,
Mhm.
specifically estrogen or testosterone. And I do want them to think of those as more so irreversible. There are some changes that do reverse if you stop these hormones, but this piece is the bigger
Yeah.
decision point. And all of this can impact fertility, of course. So I have this a lengthy discussion about all possible side effects and benefits before we get to the point of prescriptions. In terms of ages, the old guidelines said you have to be 16 and up for estrogen or testosterone. There's been a revision in 2017 of the Endocrine Society guidelines, which says that between ages 14 to 16, you can make case by case exceptions to that rule. So
Okay.
there's some flexibility around there, but very important again to have that good understanding, have the adolescent be part of this decision making and understand how it affects them. In terms of that discussion around fertility, which I was alluding to, I have that before the puberty blockers as well.
Okay.
So you might think this is only when they're older before estrogen or testosterone, because you can imagine how that might affect their, the reproductive organs they're born with. But a lot of kids, even though they're going on supposedly reversible pause medications, a lot of them will go straight from that to testosterone or estrogen.
Okay.
So that's why we have that discussion before and again when we're going on more irreversible things. So these pause medicines, yes, they're reversible, but they're pausing your reproductive structures early. So you might have limited fertility potential later if you went from them straight to estrogen or testosterone. And they can affect other things such as bone health. If we use them indefinitely without adding estrogen or testosterone to the future. So it's just very important to me have a full, honest, detailed discussion at
Mhm.
multiple time points with the family.
So are you talking to the family altogether, when you're or do you also have separate conversations with the parents? I mean, I imagine it's pretty sensitive.
Yes, I actually make sure that we are sort of doing both. So I see the family together, and it's very important to have a little bit of time
Mhm.
separately with the teen, with the patient as well, just to make sure was there anything you wanted to share with me that you weren't comfortable doing with your parent present that you want to tell me about. So I have some private time with the teen as well. We have our
Okay.
usual adolescent discussions that all people with pediatric background do privately with the teenager. Do you smoke? Do you do
Okay.
any marijuana and so on? Are you sexually active? And these are sensitive discussions that you want to make sure you're doing without the parent. Most parents understand why we need to do that. And then I'll have the parents come back and we'll discuss again what all our options are. In the state of Connecticut, we do need parental, or I should say legal guardian consent to proceed with these options. So
Okay.
it is also a discussion with the family, of course.
And you touched a little bit upon fertility. So how does your program work with CARS with us for fertility preservation?
So for those kids who are born with male biology, their fertility preservation is sperm preservation. So I'll refer them to our experienced urologist who'll have a discussion. And if they want to proceed, then they'll be referred to a sperm bank. It's a sensitive issue because ejaculation and other sperm options. It's a lot for someone who identifies as female, for example, but that would be the option. And then for those with female biology, I
Mm,
refer them to CARS. I've
okay.
had patients give me great feedback about how sensitive CARS has been in terms
Mm,
of course, name and pronoun sensitivity, but also with discussions around how we can sensitively do procedures
mhm.
and what might be all the cost options, and just being very respectful in general. So I like to refer them there to have full discussions around egg preservation.
Excellent. And do you work with pediatrics only in this, when it comes to transgender, family building, or do you also work with adults, you as in your
Yes,
practice?
in my adult practice, so 2 days a week I'm at an adult practice with Hartford Healthcare, and 3 days a week I'm at the pediatric with Connecticut Childrens. So I did a med peds residency and fellowship. And in my adult practice, actually, the vast majority of my patients at this point are also gender transitioning patients. And fertility comes up at any stage of the game. We
Okay.
want to reopen that conversation. They may not have had the opportunity or knowledge or desire when they were younger, when they started the process. But certainly when they're older, they may have different decisions and goals with family building. And so,
Okay.
once again, I would refer them accordingly for that fertility preservation.
That's excellent. How can someone learn more? Someone who's interested in learning more, how can they learn more about the program?
So for the pediatric program, as I said, there's the website.
Okay.
And then I think for my adult program, I also often would refer to the same website, especially if they're looking for a therapist or other resources. And of course, for CARS, I offer, well, why don't you check out their website and learn
Okay.
more? So I think nowadays in the world we live in, the easiest way for resources is really online. But of course, if they were to call the office, we can mail them information as well.
Okay, excellent. Thank you so much for your time, Dr. Pulvani.
It's been a pleasure. I'm always happy. This is a passion of mine. I'm always happy to speak about it.
Oh, I love it. I will just mention that the website is connecticutchildrens.org/gender. And I put it in the comments section. And if you want to check out our website, it's at yukonfertility.com. And we will see you next time for another Lunchtime Live. So goodbye for now.